My name is Iskandar. I'm a PhD researcher at the University of Manchester, and I was the principal investigator on this study that presents findings on the comparative effectiveness of biologic therapies on improvement in health-related quality of life in patients with psoriasis registered with the British Association of Dermatologists Biologic Intervention Register, also known as BAD-BIR. Psoriasis is a chronic immune-mediated inflammatory skin disorder that can have a profound impact on the patient's emotional well-being and health-related quality of life, affecting their physical, social, or psychological functioning. Patients often experience feelings of embarrassment, helplessness, and depression because of the disease. Biologic therapies are novel agents that have revolutionized the management of moderate to severe psoriasis. However, evidence of comparative effectiveness of these therapies on improvement in quality of life in patients with psoriasis in routine clinical practice is limited. Therefore, we aim to assess the comparative effectiveness of the three leading biologic therapies for psoriasis, adalimumab, etanercept, and ustekinumab, on improvement in quality of life in patients with psoriasis registered with the British Association of Dermatologists Biologic Interventions Register. We also aim to identify factors associated with these improvements. The register, established in September 2007, is a UK and Republic of Ireland observational pharmacovigilance register, which represents an ideal resource to assess the comparative effectiveness of biologic therapies due to its size, rigorous data collection process, inclusion of clinically relevant covariates, and high external validity with the participation of multiple dermatology centers. We use the self-reported outcome measures, the Dermatology Life Quality Index, the DLQI, and the European Quality of Life Utility Score Questionnaire, the EQ5D, to assess changes in quality of life at 6 and 12 months. Our primary outcome measures were changes in the DLQI total and individual domain scores and changes in the EQ5D profile and utility score between baseline and 6 and 12 months. Predictors of improvement in the EQ5D utility score and of achieving a total DLQI score of 0 or 1, indicating no impairment in quality of life, were also identified at 6 and 12 months using multivariable regression models. We found that in routine clinical practice, the use of biologic therapies for psoriasis was associated with marked improvement in health-related quality of life over 12 months. For the entire cohort, the median DLQI significantly improved from 18 at baseline to 2 at 6 months, with 46% of the entire cohort achieving a total DLQI score of 0 or 1. Similar improvements were also achieved at 12 months. In addition, 84% and 86% of the entire cohort achieved a clinically meaningful improvement in their DLQI from baseline at 6 and 12 months respectively. Moreover, significant improvement in all 6 DLQI domains were achieved at 6 and 12 months. The median EQ5D utility score significantly improved for the entire cohort from 0.73 at baseline to 0.85 at 6 months, with 54% of the entire cohort achieving a clinically meaningful improvement in their utility score. Similar improvements were also observed at 12 months. Moreover, the proportion of patients reporting having any problem in any of the EQ5D dimensions significantly decreased at 6 months. The largest decrease was in the pain and discomfort dimension, while the smallest decrease was in the self-care dimension. Similar decreases in the domain scores were also observed at 12 months. Improvement in health-related quality of life were influenced by several factors, including the choice of biologic therapy, lifestyle characteristics, and comorbidities. Female gender, patients with multiple comorbidities, obesity, and smoking were identified as predictors of lower likelihood of achieving a total DLQI score of 0 or 1, or of improvement in the EQ5D utility score. As compared to adalimumab, patients on etanercept were less likely to achieve a total DLQI score of 0 or 1, but there was no difference between ustekinumab and adalimumab in the proportion of patients achieving a total DLQI score of 0 or 1. There was also no significant difference between the 3 biologic therapies in improvement in the EQ5D utility score. In conclusion, this study demonstrated that the use of biologic therapies for psoriasis was associated with marked improvement in health-related quality of life in routine clinical practice. These improvements were influenced by several factors, including lifestyle characteristics and comorbidities, as well as the choice of biologic therapies. These key determinants of treatment response are of particular importance as they support the concept that lifestyle modification, such as weight loss in obese patients or smoking cessation, may enhance the effectiveness of biologic therapies. This study also helps in informing the selection of the optimal biologic therapy for patients with psoriasis with regard to improvement in health-related quality of life. With this, I would like to thank you for listening and viewing this video abstract, and I hope you found it interesting.